Hello, everyone. My name is Jessica Casanova, and I am from Granite Peak Healthcare Solutions. This training session is called Supporting Residents with Traumatic Brain Injury, TBI, Managing Behaviors with Compassion and Skill. We'll be focusing on how you, as staff, can provide informed, empathetic care when residents experience behavior changes related to TBI. TBI can lead to impulsivity, poor judgment, mood swings, or confusion. These are neurological responses, not bad behavior. Today, we'll talk about understanding the effects of TBI in long-term care settings, identifying behavior triggers and non-pharmacologic responses, communicating effectively with TBI residents, caring for ourselves and each other as a team. Again, thank you for being a part of this training session and for all that you do to support your residents with TBI. So let's get started. Why this matters. 1. Behavior changes often stem from brain injuries or cognitive decline. When we see behaviors like agitation, confusion, or withdrawal, it's important to remember that these are not intentional. They are often symptoms of how the brain has been affected by injury or disease, whether it's a traumatic brain injury, dementia, or another neurological condition. The person's ability to communicate or regulate emotions is altered. 2. Understanding behaviors reduces caregiver stress and improves care. Once we understand the why behind the behavior, we shift from reacting to responding. This mindset reduces stress, prevents burnout, and leads to more effective, compassionate care. It also helps prevent escalation of behaviors. 3. Empathy and knowledge are key tools for caregivers. Empathy helps us stay patient and kind, while knowledge helps us use the right strategies. For example, redirection, routine, and environment adjustments can make a big difference. Together, empathy and education are a caregiver's best defense and the resident's best support. So here are a few common problem behaviors. Wondering. This is not just restlessness, it's often driven by confusion, a need for familiarity, or unmet needs. Preventing wandering starts with understanding the resident's past routines and ensuring a safe, structured environment. Agitation and aggression. These behaviors can be triggered by overstimulation, unmet needs, or pain. They aren't personal, they are communication. Look for the root causes like discomfort, confusion, or fear. Emotional ability. Frequent mood swings can occur without an obvious cause. As a result of impaired brain regulation, support residents by remaining calm and validating their feelings. Repetitive questioning. While it can be frustrating, this behavior often stems from short-term memory loss or anxiety. Use simple, reassuring answers. Redirection or visual cues like signs may help. Resistance to care. This can come from feeling afraid, confused, or violated. Speak gently, give choices, and explain each step. Offering dignity and care reduces resistance. So here are some root causes and triggers. Cognitive decline or confusion. When the brain is injured or impaired, it can struggle to process time, place, and even people. What looks like defiance or aggression is often confusion or fear. Grounding techniques and calm environments help reduce this. unmet physical or emotional needs. Pain, hunger, thirst, or loneliness may be driving behaviors. If a resident is agitated, always ask, what might they be trying to tell us? Behavior is often a form of communication when verbal ability is limited. Environmental stressors. Too much noise, bright lights, crowded spaces. These can overwhelm someone with a brain injury or dementia. Minimizing chaos and offering calm spaces can lower the chance of escalation. Inability to communicate effectively. When a person can't find the words to express themselves, frustration builds. This can lead to outbursts or withdrawal. Offering alternative communication tools like pictures, gestures, or simple yes no questions can make a big difference. Here are a few core principles for caregivers. 1. Stay calm and patient. The most effective way to de escalate is to remain calm. Residents may mirror your tone and body language. Your calmness becomes their cue for safety. 2. Validate. Validate the resident's emotions. Even if you can't argue with the behavior, you can always acknowledge the emotion behind it. Statements like, I see you're upset, or that must be frustrating, show empathy and help diffuse tension. 3. Distinguish. Distinguish behavior from intent. Separate the action from the person. The resident is not trying to be difficult. They may be confused, frightened, or in pain. Recognizing this helps prevent caregiver resentment and maintains compassion. 4. Use. Use supportive, non judgmental language. Avoid blame or correctional tones. Use calm, supportive phrases like, let's try this together, or can I help you with something? This builds trust and encourages cooperation. This next slide talks about non-pharmacologic strategies. So we got number 1, modify the environment to reduce stress. Start with the setting. Bright lights, loud TVs, or cluttered spaces can overwhelm residents with TBI or cognitive impairment. Creating a calm, predictable space helps reduce confusion and agitation. 2. Use sensory interventions like music or aromatherapy. These are simple but powerful tools. Familiar music can soothe, and calming scents like lavender can reduce anxiety. These approaches are especially helpful in the evening or during care transitions. 3. Redirect attention to enjoyable activities. Instead of comforting a behavior head on, offer an alternative. For example, if a resident is upset or pacing, invite them to fold towels, go for a walk, or look at a photo book. Redirection works best when it's based on what the person enjoys. 4. Apply behavior therapy techniques. This can include structured routines, positive reinforcement, and understanding the ABC model. And what is that? Antecedent behavior consequence. What happened right before the behavior? What was the outcome? This helps us plan better interventions moving forward. Okay, so let's review some practical strategies tailored to specific behavioral challenges often seen with brain injury or cognitive decline. For aggression, it's important to avoid escalating the situation. Don't argue, offer choices that give that person a sense of control. With wandering, ensure the environment feels safe and familiar. Secure exits and provide purposeful activities. Repetitive questions can be exhausting, but the key is to respond with calmness and redirect the conversation or activity. Lastly, emotional ability, which refers to sudden mood shifts, requires both validation and distraction. Let them feel heard, then gently shift their focus. Here are a few communication best practices. Use clear, short sentences. Speak slowly and use plain language. Long explanations can be overwhelming. For example, say, "Let's go eat now," instead of, "It's probably a good time to think about heading to the dining room." Avoid elder speak or patronizing tone. This includes talking in baby voices or using words like sweetie or honey. Though well-intentioned, it can feel demeaning. Use the resident's name and speak as you would to any adult. Allow time for responses. Residents with TBI, or dementia for that matter, may need several seconds to process what was said. Don't rush or interrupt. Silence is okay. Giving them space shows patience and dignity. Show consistent respect and kindness. Your attitude is just as important as your words. A calm tone, eye contact, and smiling go a long way in building trust. Even if the resident is nonverbal or confused, they often sense emotion and respond to kindness. All right, so let's talk about routine and structure and how that looks like. Create a predictable daily schedule. Consistency gives residents a sense of control and safety. When the day is predictable, it reduces anxiety. Even simple routines like meals, rest, and hygiene at the same times make a huge difference. Include meaningful and enjoyable activities. Activities should align with the residents' interests and past routines. Folding towels, gardening, listening to favorite music, or looking at family photos can improve mood or reduce agitation. Encourage physical movement when possible. Movement like a walk down the hall or light stretching can improve mood, reduce restlessness, and support better sleep. Always consider what's safe and comfortable for each resident. So let's focus now on empowering self-care for yourselves. We'll start with recognize signs of burnout. If you're feeling detached, emotionally exhausted, or irritable, it's not a failure, it's a signal. Caregiving is demanding, and recognizing burnout early helps protect your well being. Take regular breaks and ask for help. You can't pour from an empty cup. Even in a 5-minute breather makes a difference. Ask for support from your teammates or supervisors when you're stretched thin. Use stress relief strategies, mindfulness or journaling. Take a few minutes to breathe deeply. Write down your thoughts or listen to calming music helps reset your mind. These tools are simple but powerful in tough moments. Connect with caregiver support groups, whether it's a formal group or a trusted coworker. Talking to someone who understands your day can lift a heavy weight. You're not alone in this work. We are here to all work together, so let's talk about team-based support. Collaborate with nurses, therapists, physicians. Everyone brings a piece of the puzzle. Nursing may notice physical triggers. Therapy may identify cognitive or sensory changes, and physicians can help adjust medications or rule out medical causes. Don't keep concerns to yourself. Share what you see. Hold care planning meetings with families. Families offer valuable insight into residents' history, preference, and routines. Involving them helps create more person-centered interventions and helps them feel involved and heard. Although we have set quarterly care conferences, we can also have care conference as needed to discuss concerns and things that we need to make sure we're all on the same page. Share behavior observations regularly. Even subtle changes matter. Document and communicate new behaviors or patterns so the team can act early. It helps prevent crisis and improves the residents' quality of life. So when is it time to seek professional help? Well, if behaviors pose safety risks or escalate. When behavior puts the resident staff or others at risk, like aggression, self-harm, or unsafe wandering, it's time to escalate. This is not a failure, it's a protective step. For assessment of medications or therapy, some behaviors may be managed better with medication adjustments, pain control, or therapy interventions. Reporting these concerns ensures that physicians and therapists can reassess care needs. Involve mental health professionals when needed. When there are signs of underlying psychiatric conditions, trauma responses, or complex behavior needs, consult mental health professionals. Their expertise supports better care planning and reduces future incidents. Here's a summary and takeaways. Behaviors reflect needs, not intent. What does that mean? While challenging behaviors are communication, residents are not trying to be difficult. They're telling us something, and it's our job to listen and respond with understanding. Remember, there is a reason why the resident is living in a nursing home. Non-farm strategies and empathy are powerful tools. You don't need to rely solely on medication. Tools like redirection, music, sensory therapy, and simply being present with empathy can change everything. Routine and caregiver wellness are essential. Predictability helps the resident, but it also protects you. And remember, you matter too. Your health and balance directly impact your ability to give compassionate care. Work as a team to support each resident. This is not one person's burden. We succeed when we communicate, collaborate, and support each other across disciplines and shifts. Understanding TBI, what does that look like? Well, TBI equals disruption of normal brain function due to trauma. A TBI happens when the brain is injured by a blow, jolt, or something penetrating the skull. It disrupts how the brain works, even if the person looks fine on the outside. It can be mild, moderate, or severe. A concussion is a mild form, while severe TBIs can lead to long-term disability. Regardless of the level, every TBI can affect emotions, behavior, and thinking. Common causes are falls, accidents, and assaults. In older adults, falls are the leading cause of TBI. In younger adults, it might stem from car accidents, sports injuries, or violence. Long-term impacts: memory loss, emotional ability, slow thinking. These residents may seem confused, irritable, or withdrawn. They're not choosing these behaviors. They're the result of how their brain now functions. Caregivers need to adapt communication and expectations when this is in mind. TBI and specific behavior challenges. These behaviors may appear unpredictable or confusing to caregivers, but they often result from how the brain has been affected by trauma. Understanding them as symptoms, not choices, helps us respond with patience and strategy. Behavior highlights: poor impulse control. A resident may act without thinking, grabbing, yelling, or wandering. They often don't have the pause button anymore. Emotional ability. Mood swings can be intense and rapid, from laughing to crying to yelling. This is not manipulation, it's a brain regulation issue. Poor initiation, follow through. They may not start tasks independently or stop mid-task. Prompts and step-by-step guidance help support them. Repetitive behaviors or fixations. Residents may repeat phrases, actions, or routines. This is often soothing to them and can reflect anxiety or memory gaps. Verbal outbursts. Sometimes language is disinhibited. They may say things that sound offensive. Respond calmly and redirect without shame. Social withdrawal or disinhibition. Some residents avoid others. Some may behave in socially inappropriate ways. Both are signs of brain injury, not defiance. Let's talk about creating a TBI safe environment. Use structure and routine to reduce confusion. Consistency helps residents with TBI know what to expect. Daily routines lower anxiety and reduce behavior outbursts by creating predictability. Minimize environmental stimulation. Too much noise, light, or visual clutter can overwhelm someone with a brain injury. A calm, uncluttered space helps focus and reduces agitation. Use visual schedules and checklists. Memory and organization are often impaired after TBI. Visual aids like pictures, schedules, or whiteboards give residents cues without relying on memory or verbal instruction. Allow extra time for tasks and responses. Processing speed can be slower. Be patient. Don't rush. Give them time to think. Speak and complete tasks at their own pace. Okay, so let's talk about interdisciplinary team and how they could support TBI. We'll start with nursing. They can monitor for physical symptoms and fatigue. Nurses are often the first to notice changes in appetite, energy, pain, or sleep. Common triggers for behavior changes. Fatigue is a major challenge for people with TBI and should be factored into care routines. Therapy, cognitive rehab, speech language support. Therapists work on memory, problem solving, communication, and physical coordination. Their role is vital in helping residents regain lost functions or adapt with new strategies. Social work, family education, behavior care planning. Social workers guide families in understanding TBI, adjusting expectations, and engaging in realistic goal setting. We also coordinate behavior management strategies and care plans to ensure a person centered approach. Activities, modified goal oriented engagement. Engagement in meaningful activities tailored to the resident's cognitive level supports self esteem, reduces restlessness, and brings joy. Activity staff help create success moments even in small steps. So here is a behavior response cheat sheet. This cheat sheet gives you go-to strategies when a resident with TBI or cognitive decline is showing challenging behaviors. Think of it like a behavior first aid kit. Stay calm. Use simple words. Tone matters more than content. Calm, brief phrases keep residents from becoming more overwhelmed. Redirect with clear instructions. Instead of saying, don't do that, try, let's go over here, or let's sit together. Reduce noise and distractions. Turn off the TV, lower voices, close the door. The goal is to simplify the environment. Use familiar objects or routines. Grab your favorite sweater, music, or a routine task. This helps ground them. Validate feelings, then offer options. Say, I see you're frustrated. Would you like to sit or go for a walk? This shows empathy and gives safe control. Be consistent and non-reactive. Even if behaviors are difficult, your steady presence is grounding. Respond, don't react. Here are a few resources I used to complete this presentation. Thank you all for participating in this training on managing challenging behaviors, especially those related to TBI. If you have any follow-up questions, please don't hesitate to reach out. Again, my name is Jessica Casanova with Granite Peak Healthcare Solutions. My email and number are listed here. Feel free to connect anytime. Thank you and have a good day.